We are back to have our budget conversations with the Metro Action Commission. Thank you so much for being here. I'm going to give you a chance to introduce the folks that you brought with you here in a second, but before I do that, I just want to say thank you to Councilmember Bill Pridemore, who is here joining us today. He is head of the budget process for the Metro Council, so you'll definitely want to say hi to him on your way out. Talia.
Okay, good morning. The Metro Action Commission administers programming and assistance to low-income citizens of Davidson County. They have a current Metro subsidy of about $4 million. They have grants of about $28.4 million and 383 budgeted FTEs. They are coming before you today with a request for $423,000 improvement for FY17. With that, Dr. Kroom.
Okay, thank you. It's good to be here.
Good to see you.
Thank you. Let me introduce to my left our board chair, Dr. Lavinia Steele, and to my right, our new Chief Financial Officer, Mr. Robert Wright, and also joining us is our Community Programs Director, Mr. Marvin Cox. This is, of course, spring break week, so a lot of my team is on spring break, as you can imagine, enjoying themselves, I hope. And so I think that's all that we have with us.
Great. Well, do you want to walk me through what
I do.
Your requests are? Thanks.
Well, I'll start with our first request, which is early Head Start.
Yes.
I think you're aware that for the last 2 years, the Metropolitan Action Commission and the school system have been working together around shared planning for expansion of pre-K and early services to children.
Yep.
And so we see an opportunity. We've been notified by the federal government that there will be an opportunity for us to apply for additional early Head Start funding. That would allow us to expand that program by approximately 72 children is what we're proposing. Based on that, 72 children, expanding by 72 children, it would allow us to move our early Head Start number from 120 early Head Start children to 190 Head Start children, 192. In addition to that, I should mention that this also gives us an opportunity to add more services to the Southeast Corridor, which is what we're interested in and where we're seeing the greatest demand for early services. Head Start requires a 20% match. So anytime you apply for Head Start funding, they require a 20% match. And so we're asking for in that first year a quarter of that match, because if we're funded, the dollars would not be available until the last quarter of the year.
Okay.
And then in the subsequent years, we're asking for the full amount of that match for the early Head Start program.
So, okay, I see. So the $119,000 that you're asking for is only a partial component of the total needed for the total match. Yes. Because when I was looking at that number, I thought, wow, we could get 72 slots for $119,000. Sign me up for times 4.
Right,
okay,
right.
That makes it, yeah. Thank you. That's more clear. Okay. Talk to me about the difference between early Head Start and Head Start, because you're talking about these are early Head Start positions, not Head Start positions. So what's the difference?
Well, the difference is early Head Start starts with pregnant moms through children age 3. And so when the child turns 3, then we can automatically enroll them, as long as the parent still income qualifies, into the Head Start program. So early Head Start is the same basic approach that you're using for Head Start program, same work you're doing with families. You're just starting earlier and actually starting before that child is born, because as you know, if you can help the mom have a successful pregnancy, then you increase the opportunities of that child being born without certain type of developmental delays. You have a better chance of ensuring a healthy pregnancy, consequently a healthy birth.
Right. So, I mean, by adding 72 slots, that's pretty phenomenal.
Yeah, it would be great.
What's the likelihood that we will get this grant?
Highly likely. Until this year, we're the only administrator of early Head Start services in Davidson County. Okay. Now TSU has an arrangement with, I think, 18th Avenue and 15th Avenue to provide early Head Start services. Unlike the 4-year-old program, where you have some pre-K expansion that we have happening in the city that doesn't charge parents, early Head Start is really the only program that parents can attend with their children and not have to pay for their child to go. And so we could expand by 4,000 slots in Davidson County and still not serve the children that need to be served. So
We're going to have 192 slots.
But we'll have 192.
4,000.
Right.
That's
What
our
does
gap.
TSU have? How many slots does TSU have?
TSU, I think, has about 72 as well.
They haven't started their program yet.
They have not. Now, they are, I think they're ready to go. They have received the funding, but I don't think the actual classes have started, and I could be misstating that. The other thing it's good to know about the fact that they're doing early Head Start is that when those children leave their 3-year-old program, they can actually qualify to come into our 4-year-old program. So it's an opportunity for continuation of Head Start services for those families as well.
How many Head Start slots do we have for the Head Start program?
1,365. And we had 1,485. We actually reduced the number of 4-year-olds as pre-K was expanding. We pulled our number down by 120 and then increased the number of early Head Start that we had that was originally at 72. We moved early Head Start to 120.
I see.
You notice it's not a one-to-one exchange because
Yeah.
early Head Start is a lot more expensive. In Head Start, the ratio is 10 to 1. In early, it's 4 to 1, and that's teacher to children. So you can imagine that that program is a lot more expensive to administer than the Head Start program.
I think you shared with me that to add these slots, that was not going to put any pressure on the facilities themselves, that you had places.
We do have
for these,
places.
but at what point, this is the question, at what point,
Right.
as you continue to add slots, does it put pressure on your facilities to expand?
Well, thank you for that question, because we also have a capital request to expand facilities. Thank you, Talia. That was a great lead-in. One of our
I never made that kind of mistake.
right.
I never get a leading question like that. Like, I don't know what's wrong. I don't know what's going on.
We were told that with Talia in this role, it was a new day, and so we see that it is. We made a capital request also to expand our services so that we would be shifting some of our spaces, our existing north location spaces, we would shift them to southeast Davidson County. So it would allow us to shift about 90 spaces, 4-year-old, 3 to 4-year-old, or 4 to 5-year-old spaces, in addition to being able to expand early services in that community. And
And you
so,
said southeast. Yeah.
yes,
Yeah, and we had put a little money in last year, I think, for planning, but I'm not sure where that stands. I haven't really kept up.
there was about $500,000 put
Right.
in for planning, and so we've met with General Services
Okay.
just to talk about where we would look in Southeast. Of course, we know that we would need to meet with the council persons in that community as well, just to talk about any thoughts that they have about us expanding into that area. I think I should mention that we already serve about 600 children coming from the southern corridor, as we call it. And so many of those children are bused to our existing locations. Our goal is to try and get buildings closer to where the children live. Fortunately, sitting on the Pre-K Advisory Committee, we were able to plan those spaces together. For example, we just met with Pre-K.
Right.
And we looked at where they were going to expand their 4-year-old programs, and they are only able to serve 4-year-olds with the current grant that they have, and figure out a way for us to not end up creating a gap in services, because we go up to 100% of poverty, they go up to 200% of poverty, so we want to make sure that our planning is making sure that kids who need our services have access to both programs.
Got it.
Have you identified some potential areas now with General Services?
We have
So-
identified some potential
Okay, so we
areas, but
see it.
again, we know that we have to speak
Yeah,
with council.
yeah, we need to have some
Yeah.
follow-up on that.
We
Good.
do.
Okay.
Okay.
Done?
So, do you know, though, I guess back to the question, at what point would you need how many children does a site provide? You know, if you got expanded by 150 instead of 72, does that mean that you would even have the physical space to
We would not
put
have
those
the physical
children?
space.
That's what I'm just saying. At what point, what's the trigger to actually look at expanded space?
If we expanded beyond the 72, we know we would need to go into a
take the
different space.
well, you can take the 72 now.
We could.
But then you would have to have additional space for more kids. Okay.
And part of that, Talia, as you probably know, is working with partners as well.
Exactly.
So it isn't necessarily all in our building. For example, we're talking with Susan Gray about trying to do some work with them as well. So in terms of our own capacity, the 72, we could handle some working with partners, but anything beyond that, we would need to be in new facilities.
Okay, that's good to know. Yeah. Okay.
Rich?
No, that's.
That's all I've got.
Thank you. The next item that we have listed is for, I have to take these off to see, I'm on the other side of things, I guess, is we requested $104,000 for salary and benefits, and this is specifically as a result of last year's request. We made the request to this body for the 2.5% increase for our staff, the same 2.5% increase that was given to the rest of Metro government. We were told that we were receiving that increase. However, when we looked at the actual budgeted amount that was given to our organization, it did not meet the 2.5%. And so we were asking for to be made whole with that request. And so that's why that information is listed as a request for the next year's budget, and then for that request to be recurred. We were awarded $200,000. The information that we have shows that that award should have been just at $304,000. That includes benefits for that award, and so that amount is there to ask that we be made whole with that 2.5% request.
We're aware of the request.
Okay. Shall I move on?
Yeah.
And so the next request, now I want to make sure I point out, if you'll notice, we don't ask for anything programmatic, except in the case of early, we ask for match. That's because we're really very fortunate. If you look at the goals that you've laid forth, the things that you've prioritized, our grant funding actually covers those priorities. So when you look at your priorities around youth, the community services block grant funds is covering that. When you look at your priorities around education, the Head Start program takes care of the actual program components and the majority of the staff. So our requests generally are going to be geared around helping us to support the staff of our organization. And so the third request is in line with the request before it. The Head Start grant requires a 20% match, but our cost of both our benefit cost and our salary cost, mostly our benefit costs overall, are driven by metropolitan government, because we're fortunate that our team is a part of the benefit structure of Metro. However, both the grants that we receive and the match that we receive does not cover that. In previous years, it's required approximately $400,000 or so more dollars from my budget, meaning dollars that I'm able to get into the admin budget to cover that increase or the overage for Head Start. We noticed this year that there's an actual decrease in the pension amount that is listed, even though there's anticipated cost in some other areas. So our budget request is that there be some supplement added to our match for the Head Start program that allows us to address our inability to continue to meet the benefit cost for the Head Start program. Talia's heard this before, Rich has heard this before, and I have to say it to you as well. For the benefit of the leverage, for $4 million, we leverage $24 million of federal money that comes into the city. But the federal grantors are very clear. There's only so much that they're going to do in terms of their willingness to support our staff and the necessary increases to their benefits and to their salaries. So that's why that request is there.
So what are they covering now for your benefits? 5%?
Well, here's how it goes, and we just had this conversation. They're going to give you $12 million. And if you use it all on benefits, you can use it all on benefits, but that's all they're giving you. So it looks like they cover probably about 30% of our benefit costs, and you know our benefit costs are closer to 46% of our budget. So as a further example, our salaries and benefits combined at Metropolitan Action Commission is over $11 million. The entire Head Start budget, not early, the Head Start budget is only just over 10. So when you look at the fact that when they say it's an 80%, that's all they're giving us, and the reality of it is what they call 80% is really not covering the full cost of the program, even when we add the 20% match to that.
I understand it.
Yep. Doug, anything else?
No, I'm good.
Rich, anything else?
Thank you for the.
I so appreciate all you do.
Thank you.
And thank you for serving the folks in our community who need you the most.
Thank you.
I believe that you provide an incredible safety net for so many, and I'm truly grateful to you and your staff. So thank you so much. I'm hoping they are out there enjoying their spring break this week.
The only other thing I'd add, when will we know on the expansion of the early childhood?
We won't know, we don't expect we'll know anything until next year, I mean, really around January or February,
okay.
because the RFP, they've just done the announcement that the RFP will be out in May. Generally, if they say it's out in May, it'll be out in July.
Yeah.
It'll be due sometime in November or December,
Yeah.
and then we'll hear back.
60, 90 days, yeah.
Yeah, that's why we're saying
You
we
really will have a hard,
money until-
you really will have a hard time getting much going
For the quarter,
in
right.
fiscal 17.
So it's really the last quarter of the year that
Right.
we're thinking.
Yep. Okay. Thank you all for being here. We really appreciate it.
Thanks for having us.
Thanks for the cookies.
Yeah, thanks for the.